I'm Kyle Davis. I'm a pediatric hematologist and I work at IHTC. My particular areas of interest are in bleeding and clotting disorders, and I hope very much to make the experience feel like an educational session when families come in to see me. The reason I went into medicine originally was because I had my own experience as a patient with a bleeding disorder. So I, throughout my life, have been motivated by that experience to become a doctor and take care of other patients with similar conditions to those like mine. So my goal when families come to meet with me is to try and make sure that they understand the condition that their child has, to make sure that the questions that they bring to the meeting are answered. And I try very hard not to use a lot of medical terms, but rather use the terms that are understandable and clear to them by the end of the visit. As I see myself as a teacher in the clinic, I really want to support families to feel like an advocate for their child. I find often families need to stand up for their child in certain contexts. Sometimes that's school, sometimes that's a trip to the ER, sometimes that's being in the hospital. And I want families to have the knowledge and the education in order to feel comfortable advocating for their child and speaking up when they need to be heard. Patients don't ask to be born with the conditions that they're born with. Because of that, I'm highly motivated to help them live the lives that they want to live as if they didn't necessarily have that condition. I want them to be able to participate in sports, activities, theater, all the types of activities that they naturally want to engage in if they didn't have the medical condition that they come to see me for.